Hi, so my name is Lauren, and some of my other classmates are going to be giving you an overview of heart disease. So you may be wondering what heart disease is. It's really just a very broad term to describe many diseases that can affect your heart. So one of these is coronary artery disease, or CAD, and it can involve any infections in the heart, any defects that you're born with, or any disease that can happen to your heart. It also refers to conditions that can narrow or block the blood vessels, and this can potentially cause angina or chest pains, myocardial infarction or heart attack, and stroke. So you may be wondering, who gets heart disease? So there is a much higher incidence in those that have a family correlation. So if, like, your father had heart disease before age 55, there's much higher incidence, and as well with females under 65 who acquire heart disease. There's also a higher incidence among whites, African Americans, and Hispanics, and it's the leading cause of death for them. For American Indians, Alaska Natives, Asians, and Pacific Islanders, it's the second leading cause of death. So it's very prevalent in many populations. Also, there's an increased incidence of heart disease among the older population, so 65 years and older have much higher rates of heart disease. Also, men, there is generally a higher incidence of heart disease among men than women, and so our next slide will be about the geography. So there actually is a geographical correlation of heart disease and where you live in the country. So it tends to be much more in the southern states like Louisiana, Mississippi, Alabama, Oklahoma, and then up into like the Kentucky and West Virginia area. So the map is, you can see where the denser the colors are is also the denser rates of heart disease. So you can see where I mentioned earlier, the Louisiana, the Alabama, and the Mississippi areas, and there's also almost none in the western part of the country, like Arizona. So the risk factors, what can you do to not get heart disease? So you have your modifiable risk factors, which means you can do something about stopping the progression, and that's high blood pressure. So if you have high blood pressure, or a blood pressure over 140/90, you definitely have a risk. So you can decrease your risk by decreasing your blood pressure. And you can do this by eating a well-balanced diet and getting plenty of exercise. So the next risk factor is high cholesterol. Again, you can decrease your cholesterol levels by eating a good diet and exercising. When you have high cholesterol, your arteries tend to get blocked or narrowed, which is the leading factor in heart disease. Also, smoking. So smoking narrows your blood vessels, which makes your heart work harder for the blood to get pumped through your body. Obesity. So this kind of ties into the high cholesterol and high blood pressure. Your heart has to just work much harder to get the blood all the way through your body. So, losing weight, you can do that with, again, a good diet and good exercise. Excessive alcohol consumption, so drinking 2 or more drinks a day, can definitely raise your risk. Physical inactivity and diabetes, again, goes so much with the high blood pressure, high cholesterol, and obesity. So eating a well-balanced diet and getting plenty of exercise. So there are also unmodifiable risk factors, which we'll now talk about. Unfortunately, you can't do too much about these risk factors because you're just born with it. Family history. Like I mentioned earlier, there's higher incidences of heart disease in families that have many people with it. So if your grandma and your mom have heart disease, you're probably going to have heart disease too. Age. So there's an increased incidence among those that are 65 years and older, because as you age, your risk for the disease of your heart goes up. Gender. Males are just at generally a higher risk for heart disease, with postmenopausal women coming next. Also, your race. African Americans are at a much higher risk than whites and Hispanics, but the whites and Hispanics still have an increased risk as well. So what are some signs and symptoms of something happening to your heart? So generally, you'll have some chest pains, shortness of breath, and dizziness, fainting. You may have some tingling or weakness of extremities. Also, maybe a headache, or you're seeing some spots. And now I will pass it on to Selena.
Okay, so I'm Selena, and I'll be talking about detection. Some ways to detect heart disease include EKGs. They are used to monitor heart rhythm. They also use the exercise stress test, which allows for them to see how well your heart works under stressful situations. They do lipid panels to detect the high levels of triglycerides and LDLs with low HDLs. And they use heart scans as well to help see the extent of the narrowing in the arteries of your heart. They also, if you have positive risk factors, then that is evidence to the healthcare provider that you have the risk factors for that. For treatment, you will have to do some lifestyle changes, such as stop smoking, increase your exercise. They also use medication for treatment, which includes diuretics, ACE inhibitors, beta blockers, daily aspirin regimens, and cholesterol lowering agents. They also have surgeries which are used to help clear blockages in your heart. So prevention and management of heart disease includes exercise regularly, maintain a healthy weight, eat a healthy, heart-healthy diet, also take all your medications as prescribed, and keep your blood pressure, cholesterol, and diabetes under control, and then stop smoking as soon as possible. So how heart disease affects the dimensions of health. Physically, heart disease may cause you to feel fatigued or short of breath, tired generally. Emotionally, you may experience some anxiety, fear of dying, or depression related to your heart disease diagnosis. Intellectually, you'll have to make decisions about your care and comply with medication regimens. Environmentally, the dimensions of health related to heart disease may require you to have home health services. Also, it includes your dietary habit changes, and also you must avoid extremes of heat and cold. Socioculturally, it may affect your relationships due to being fatigued all the time. You may become less active, and you also may have to work less hours, which may cause financial strain. Spiritually, you may attribute the illness to punishment from God, or you may feel that a higher power will provide assistance for you through this trying time. And now Gabby will come and talk about rehab.
Hi, I'm Gabby. I'm going to give you a little bit of facts about rehabilitation. Now, having a heart attack puts you at higher risk of having another heart attack. The presence of AFib can also be a major risk factor in heart disease, and lifestyle changes combined with medical care can also help reduce your risk of another heart attack. These are some goals that we put together as far as rehabilitation. It's very significant to get rehabilitation, get assistance right after any major heart attack or any kind of major, heart condition that just happened, just to let you know you're not alone. The goal of rehabilitation is to educate you about the disease and also to help the patient return to the best physical possible emotional health they can be. Rehabilitation is a supervised program, and it also includes physical activity. They give you some examples of lifestyle changes that can help you. They educate you about your emotional and spirituality, and also give you a little bit of information about preventing another heart attack. The courses are on a weekly basis. Again, they do provide information about management of the risk factors, medication, cholesterol, stress management. The classes are available for the individual recovering from a recent heart attack, or ongoing maintenance exercise programs also provided. Exercise classes are medically supervised, so you'll have somebody there with you assisting you as you're exercising, monitoring your vital signs, monitoring your blood pressure. EKG will be done as well, just to make sure that everything's working properly. A physician referral is required for cardiac rehab, and in most cases it is covered by your insurance. Support and spirituality. It's very significant for some people to have that spiritual support right after a tragic event as a heart attack. So it's generally described as awareness of something greater than an individual's self. It is often expressed through religion and or prayer, and although there may be many other paths to spiritual pursuits and expressions, it's good to have somebody by your side. And a support group is a great way to connect with other people that also went through a similar situation, and it's also good to have that support for the caregiver. So church or synagogue may be one of the best resources. Religious organizations offer spiritual support as well as services like respite care and meal plans. So it's a built-in community that most likely includes other heart diseases and stroke caregivers as well. So we just want to say thank you so much. Hope you enjoyed our presentation.
All right, and this is our overview of heart disease.